The same thing is true post-operatively. Now, I want to be careful in how I say that. It doesn't mean that you shouldn't try to take the medicines post-op, now that we're over the pre-op. Some people, when they listen to my this description, when I'm trying to kind of calm you down, because some of my patients come to me and they're like, how can I get the Tums in at 2:45 in the afternoon when I'm going to be taking my Pepto-Bismol at 2:33, and it says that I have to wait, and they just start to get real tense about all the medicines. So the first thing I want to do is calm you down and say missing a dose or two of your medicines is not important. Now, having said that, then some people misinterpret it and go to the other extreme, and I have a man, because they kind of don't listen that well, I don't think, sometimes. But at least you don't get grumpy. So. But this guy calls me from Florida, and he had kind of burning pain and indigestion and everything. I said, oh, it sounds like an ulcer. Remember, that's one of the most common things we get. And I said, have you been taking your medicines post-op? And he said, no, you told us it wasn't that important, so I didn't take anything. So there are kind of two extremes here, and we'd like you to have that kind of balance in the middle. So the one kind of person is just like they give you this look in clinic about the medicines. And they often have written out a spreadsheet in Microsoft Excel, which they've printed out, and they say, I'm not sure about my noon medicines. I was wondering if I should go with Tums, Pepto-Bismol, fish oil, Citrasil, or Citrasil, fish oil, Tums, Pepto-Bismol. So again, let me kind of say that's one extreme, the real tense person. And then we have the person who hears, well, they're not that important, therefore I won't take any. And so what we'd like to do is balance. We could give you such a demanding assignment of medicines post-op that it would be impossible to fulfill that. So again, we want you to try and balance things to have a wonderful life, but recognize there are some risks to the surgery. And let's go over the risks again. Let's take a few minutes to talk about the risks. The biggest risk is getting an ulcer. The second biggest risk is you're going to get low something. The most common thing is low iron. But there are other vitamins and minerals that can get low. Now, to protect against those two problems, the ulcer and the low something, iron, B12, some vitamin or mineral, we have advice for you. Take some supplements, take a little vitamins, eat kind of healthy, avoid things that cause ulcers. And we think that that's fair, that that's a reasonable trade-off in return for a 150-pound weight loss, or 200 or 100 or whatever you get.